Greetings and happy International Nurses Week. My name is MADELINE A NAEGLE. I'm Professor Emerita at Meyers College of Nursing at New York University in New York City. I'm also continuing to practice as a nurse psychotherapist. And I've been a nurse for 60 years. You can imagine during that time, I've seen lots of changes. I am proud to celebrate with you a profession that embraces the art of caring, but is also based on science. It's based on science and evidence that quality nursing care results in better outcomes for our patients. The global COVID-19 pandemic disrupted societies all around the world. One good outcome, however, was it demonstrated that nurses are invaluable members of our healthcare team. Without us, there would be no healthcare. It also laid bare the threats to health professionals when their resources are limited and when they are insufficient in number. It demonstrated that we experience moral injury. That is, we find our ethics compromised and we find ourselves doing things which are not good practices because our resources are limited and because we're few in number and because we're in a crisis. It demonstrated the toll that vicarious trauma takes on us. Vicarious trauma is when we feel with our patients, psychologically, sometimes physically, the pain they're experiencing. We have difficulty setting boundaries on that. And it also made very clear that health professionals, especially nurses, suffer from higher rates of burnout, depression, and self-harm than other workers in situations such as the COVID-19 pandemic. The global nursing response from the International Council of Nurses, from national nurses associations all around the world, is renewed focus on nurse well-being. We want improved access to mental health services. We want better working conditions. We want time for vacation and time for sick leave. We want benefits related to parenting and family needs. Globally, 1 in 8 persons suffer from a serious mental illness. And yet, there are only 300,000 of us mental health nurses. And we are not evenly distributed around the globe, so that in low and middle income countries, there are only 0.4% of nurses per 100,000 people who need our care. In developing countries, high income countries, there are 29 per 100,000. So you see, the discrepancy is very wide. It means that many, many people, even in the United States of America, which we sometimes hold, excuse me, as a standard, we know that 18% of people who have a mental health or a substance use disorder never receive care. So many people around the world do not receive care either. Our resources are strained, and we must work to ensure that we care for ourselves and our colleagues in order to continue our work in this proud profession. That means making choices for yourself, for your best position to be located where you feel gratified and appreciated in your work as much as you can. I encourage you to pay attention to your well-being, to work to position yourself in rewarding jobs, to continue in the footsteps of Nightingale and the St. John Hospitallers, who established a strong humanitarian position and many, many traditions which we want to uphold. Those traditions are the heart of healthcare. So enjoy this week. I hope you take some time to rest and have a wonderful day on the 12th, celebrating the birth of our founder, Florence Nightingale. Special thanks to Catalina for making it possible for me to bring you this message. Bye for now.